Hi, thank you for getting in touch and inquiring about the medical tattooing course with Scar Blend Academy and me, Jo Bragazzi. So if you're already a permanent makeup artist and you want to add this treatment to your treatment portfolio, then you're doing it at the right time. This treatment is growing in popularity very fast, but we're nowhere near as popular as, let's say, permanent makeup. We've got permanent makeup artists popping up every day and on every corner. More and more people in the public are knowing that medical tattooing is out there and is there for them. But not very many people at the moment are doing the courses. A lot of new permanent makeup artists are wanting to obviously refine their permanent makeup skills and get some experience with that. So you are probably coming in at the right time, because the curve is gradually going up, but we're still sort of down here at the moment, but it's gradually increasing in popularity and accessibility. So the way I've designed the course is very much from my medical background. I've been a nurse and a nursing sister for over 25 years, and I've worked in dermatology and head and neck surgery, general surgery, A&E, breast care, chemotherapy, you name it, I've done it over the years. And what I really have noticed is that some of the courses I've been on, I really wanted a lot more medical background coming towards me in my direction from the tutor. And I haven't really ever had that apart from when I've nursed. And so when I wrote this course for permanent makeup artists, particularly let's say you've come from a beauty background or a background where you've never done anything with anybody's body before apart from face, this is actually quite different. So from a nursing perspective, from a medical perspective, we look at very deeply into the anatomy and physiology of scars, how they are formed, how they heal, what it is we're working on underneath the skin, because we're not working on healthy skin. And if you can start working on damaged skin and understand how to work with that and not damage it any further, then you can easily go back and work on healthy skin, because this is very advanced work. So I very much give you all I can from my knowledge and expertise in the medical field and working with wounds, working with damaged skin. We are working primarily with patients, and I say that more than clients because our patients have more of a mental health journey, more of a physical journey. It could be cancers, it could be self-harm, it could be all sorts of surgery. So not only cosmetic surgery, where they've obviously been unhappy with their body before the surgery, but also, you know, it could be laparotomies they've had, or mastectomies, or they've had cancer, skin cancer removals and skin grafts and burns. And we are working with a whole array of different, not only mental health issues, but physical issues. So these people have come with a journey. And it's not really just a cosmetic treatment we are providing. It's more of a holistic treatment. We don't always use colour on scars. In fact, that is very much the last part of our treatment plan. We're going to use different serums and different treatments to be able to reconstruct healthier skin cells within damaged scar tissue. So scar revision is one of the names for it. So we are really helping the health of the scar before we come into the colour work, so the ink work and the colour and scar camouflage. This course covers scar revision, scar camouflage and inkless medical needling. I use polynucleotides, different serums and exosomes. I'm not brand specific. So the idea is that with lots of different things coming out nowadays, I teach you about the different serums and the different brands of inks so that you can go away and you can mix colours or choose a treatment plan that is right for your client or your patient based on whatever brand you have chosen. Obviously with inks, as long as it's REACH compliant, then we have to sort of look at the chemistry and the composition of each inks and we are looking at the composition of the scarring, and it's very different to working on healthy skin. So when you're looking at brows and lasering brows, you're looking to make sure you don't have a lot of yellow and white component within that ink. Well, in Scar Camouflage, we actually need the white titanium dioxide because quite often we are camouflaging darker scars with lots of capillary action, particularly in skin grafts. So it's a very different method of working. And it is a much more advanced method of working because we're working on damaged skin and not healthy skin. So the course is very in-depth, but what I've tried to do for permanent makeup artists is condense it down as much as I can, just because you've got your own businesses that you're running. So the structure of the course with me is 1 day theory. So 1 day theory with working on colours and colour mixing, treatment plans, scar, anatomy and physiology. We will be working with all the colours of skin, so from very, very pale, almost translucent skin to very dark, almost bluey black skin, and everything in between. So that first day is looking at the different colours, the different inks we use, the different serums, scars themselves. It's quite a packed day. And then in the afternoon we look at different compositions and configurations of needle cartridges that we use more in Scar Camouflage, and how to use them. They're big configurations, so you might not have ever used these before. And different techniques to get the most realistic and long-lasting scar camouflage. The second day is when we do some practical. So I've got 2 options for permanent makeup artists. You can either have 2 practical days with me to really hone your skills, and we get in as many different scars as possible. I try and get in 3 or 4 patients a day, and invariably they have got many scars. So you can either have 1 practical or you can have 2 practical days. And I either run the courses with mentorship, 6 months mentorship, or without 6 months mentorship. It depends on your budget. It depends on how you feel your experience with permanent makeup has been, and if you've worked on any scars before. So with permanent makeup artists, the courses are a little bit more bespoke, depending on what you need. But what I would say is you definitely need that initial theory classroom day with me. And at least 1 practical day. Now, with any of these courses, you get the online course, so that's the pre-in-class course with all the modules that you need, ready to get you started with me, and you get the full course manual. So it doesn't matter whether you choose 2 days or the 4 days, you still get those as well. So you've got that as a backup for when you need to refer to it. So if you think this is something for you and you would like to upgrade your skills and upgrade your treatment offering, then let me know. We'll book a free video call for you, and you can ask me as many questions as you would like. Just get a notepad and write them all down and bombard me with them. I really don't mind. We've got to make sure this course is right for you. That's the main aim, is that it's got to be right for you at the right time. So just let me know if you're ready and we'll have a little chat.